Choosing the right bariatric procedure can be an intense search. It can be a difficult decision to make, but it's something that the patient can make in collaboration with their surgeon. Dr. Steinberg and I will sit with the patient, go through the various procedures that we do offer here, and help the patient choose the right procedure for them. The decision may have to do with the amount of weight that needs to be lost. It may also have to do with the medical conditions that the patient has. Sometimes past surgeries may affect which procedure we can do safely. All of those factors come to play together, and once the patient comes to the seminar, we allow them to see the procedures that we do here, the risks and benefits of each of these procedures, what the procedure entails. And on the subsequent visit in the office, the consultation, we'll have a further in-depth conversation with the patient. And the choice is ultimately the patient's, but we'll help guide the patient's choice.
The surgical procedures performed at our bariatric surgery center include the laparoscopic gastric band, the laparoscopic vertical sleeve gastrectomy, the laparoscopic Roux-en-Y gastric bypass or laparoscopic gastric bypass. In addition, we also perform the laparoscopic removal of gastric bands with conversion to either a sleeve gastrectomy or a gastric bypass.
The benefits of bariatric surgery are numerous, and they span everything from medical amelioration of comorbidities to physical constraints to psychological issues. For example, patients who have diabetes will see an almost immediate resolution of their diabetes, of their type 2 diabetes, that is, if they've had that disease for less than 7 or 8 years. High blood pressure becomes improved, cholesterol becomes much more improved. Same thing with the sleep apnea. The risk of cancer decreases after this weight loss and the surgery. A lot of issues of physical constraints, things like fitting in chairs that have arms like this chair, being able to fit into airline seats and not having to use 2 straps or not having to use 2 seats. So those physical issues also become markedly improved.